Flinders' unique footprint across the Australian Central Corridor is a distinguishing feature of Flinders University. It gives us the opportunity to develop leaders, to develop our workforce of the future for this unique, diverse and rich environment. Flinders is committed to ensuring that these communities have a vibrant, diverse and committed workforce for the future.
Our Flinders Rural and Remote Health SA campuses are located in Mount Gambier, Victor Harbor, Murray Bridge, Barossa, Renmark and Berry. We also provide accommodation for medical, nursing and allied health students on placements in medicine. Our passionate team of staff support students to undertake a year-long clinical placement program called the Doctor of Medicine Rural Stream, or MDRS. The MDRS was established over 20 years ago in the Riverland region for students in their third clinical practice year. MDRS students are supervised and supported by doctors living and working in these rural communities. Each region also has a dedicated team of Flinders University educators and support staff to ensure our students are well looked after. Approximately 40 Doctor of Medicine students have the option to spend their entire third year in a rural community setting, actively participating in the care of patients through a local medical practice and associated health services. This program is a highly successful rural workforce recruitment initiative, with GP role models introducing medical students to the rigours, challenges and rewards of rural medicine. World recognised and highly regarded, the program has produced medical professionals of the highest standard, with the highest rate of return to working and living in regional communities of all South Australian universities. The broad, integrated and flexible nature of this course ideally suits students who thrive in a learning environment that encourages self-directed autonomy, responsibility and cooperative involvement in the ongoing care and life of individuals, their families and rural communities. Flinders interprofessional educators in each region assist in delivering clinical simulations and skills training with local medical professionals and specialists. Our academic team and program administrators ensure students are supported during their rural placement. Flinders educators work with Doctor of Medicine Rural Stream students each year and involve nursing and allied health students in simulations where possible. As the program is postgraduate, the background of medical students is varied and includes engineers, pharmacists, paramedics and registered nurses. Throughout the year, the students are exposed to diverse simulations to gain experience and knowledge for their clinical years and into the future as an intern. Flinders University supplies and manages accommodation for students from metropolitan and rural and remote settings who are undertaking placement in rural and remote areas for medical, nursing and allied health professional experience placements at hospitals and health services throughout rural and regional South Australia and the Northern Territory. Research over a long period of time shows that rural background is a significant predictor of students returning as graduates to work in rural and remote health services. We aim to grow the number of rural background students and graduates of health programs, increase the number of Aboriginal and/or Torres Strait Islander students and graduates, expand our activities into more remote communities and in ways that increase access to education, training and research, increase the number of rural and remote students studying locally, co-design our projects and strategies with rural and remote communities, health services and partners, embedding local priorities and culturally safe practices, and develop evidence-based strategies that support a sustainable and flourishing health workforce in rural and remote Australia. Growing evidence suggests that health and medical students who undertake extended training in a rural area and those from a rural background are more likely to join the rural workforce upon graduation. Regional training hubs are funded by the Commonwealth Department of Health RHMT program to contribute to a rural medical training pipeline that encompasses medical students, pre-vocational graduates, vocational trainees, and finally, rural generalist GPs and medical specialists. In South Australia, Flinders Regional Training Hub supports the Rural Junior Doctor program by working with Limestone Coast Local Health Network to provide accredited intern and postgraduate Year 2 or PGY2 programs at Mount Gambier Hospital. Interns and PGY2 appointees in Mount Gambier work as part of a clinical team with guidance from a specialist term supervisor and salaried medical officers. Flinders staff provide educational expertise and a nurturing learning environment for all junior doctors. The Limestone Coast Local Health Network offers a full year of internship in a rural environment with accreditation from the Medical Board of South Australia. Flinders University recognises the unique position of Aboriginal and Torres Strait Islander Australians as First Nations people and is committed to providing them with education informed by engagement with Aboriginal and Torres Strait Islander peoples and communities. We recognise the resilience and cultural diversity of First Nations people, and we have learnt that connection to culture and to cultural understandings are high priorities when it comes to maintaining well-being. We aim to respond to those priorities in consultation and partnership with Aboriginal and Torres Strait Islander organisations and communities, acknowledging our responsibility to First Nations citizens. Flinders University Rural and Remote Academics undertake strategic research into the key themes of rural health workforce, clinical education, innovation in health service delivery, mental health, dementia and Aboriginal health and wellbeing. We partner with other universities, government and communities to address local, national and international rural health challenges. Through our highly successful academic programs, rural students also contribute to our research outcomes through community engagement activities and projects. Flinders University nursing students are able to undertake the entire Bachelor of Nursing degree at the Flinders University Renmark campus, with opportunities to complete their placements and training in a friendly and supportive rural environment.
Through the transformative power of education, research and partnerships, we aim to inspire the next generation of rural and remote health workforce to take up this opportunity to contribute to the health outcomes of people living in this amazing country. Having introduced you to the richness of our people and programs, it's probably worth just revisiting the vision that we have for the future. Our aim is to increase the number of Aboriginal and Torres Strait Islander students participating in our programs and graduating from them. Similarly, we aim to increase the number of rural students who are participating and graduating as close to home as possible. We aim to inspire our communities through evidence-based research and participating in research that improves health outcomes. What can you do to be part of this vision? Well, you can have Flinders as your first choice to study medicine, allied health, nursing, public health, or as a higher degree research student graduating with a PhD.